In a parallel world, the expiration of key Affordable Care Act subsidies at the end of March, a wave of anxiety is washing over the nation's healthcare landscape. Experts and advocates warn that millions of Americans are now facing dramatically increased premiums, limited coverage options, and a significant risk of losing access to healthcare altogether. The federal government's decision to halt the enhanced cost-sharing reductions, payments to insurers to lower out-of-pocket costs for patients, has triggered a ripple effect across the marketplaces. Insurers, fearing financial losses due to rising premiums, are pulling plans from the exchanges, leaving consumers with far fewer choices and significantly higher costs. What we're seeing is a dismantling of the foundational protections built into the ACA, said Dr. Emily Carter, a public health researcher at the University of California, San Francisco. The CSRs were crucial for keeping premiums affordable, particularly for lower and middle-income individuals. Without them, insurers are raising rates, and many are pulling out entirely. Estimates suggest that premiums for unsubsidized ACA plans could rise by as much as 30% for 2024, making coverage unaffordable for many. Over 150 insurers have already announced they will not offer plans on the exchanges for 2024, leaving consumers in areas where only one insurer remained. The ACA provided critical protections for individuals with pre-existing conditions, guaranteed coverage for young adults, and eliminated lifetime coverage limits. These safeguards are now threatened as the market shifts. Projections from the Kaiser Family Foundation estimate that as many as 1.5 million people who currently have coverage through the exchanges could lose their insurance by 2025, with millions more potentially facing unaffordable premiums. "I'm terrified," said Maria Rodriguez, a single mother from Houston who receives her health insurance through the ACA. "My premium has already doubled. I don't know what I'm going to do if I lose my coverage. I need to take my child to the doctor regularly. This isn't just about money, it's about our health." The move has ignited a fierce political battle. President Biden has condemned the decision, arguing it jeopardizes the health of American citizens. Republican lawmakers, however, maintain that the ACA was flawed and that the changes are necessary to foster competition and lower costs. As the uninsured population rises, healthcare advocates are calling for Congress to take immediate action to stabilize the marketplaces and protect vulnerable populations. Proposals being considered include expanding premium tax credits and exploring options to encourage insurer participation. However, with deep partisan divisions, the future of healthcare access in the United States remains uncertain.